Hi, I'm Kerry. I'm one of the ambulance clinicians here at the East of England Ambulance Service. First of all, can we please say congratulations on your pregnancy? Here at the East of England Ambulance, we know that pregnancy is both an exciting and worrying time. And we want to reassure you that when emergencies arise, we are here to support you. Pregnancy can be a time of huge change in your body, and this means you may seek advice on what is normal and what may be concerning. During pregnancy, you should be given the contact number for your named maternity unit or your named midwife. This is the first number that you should call if you have any concerns that arise. That is because the midwifery team are the experts in pregnancy and are best placed to let you know what to do next. During your pregnancy, your midwife and obstetricians should discuss with you reasons that may be of concern and also the normal process of labour and birth. You should also discuss at this time and make plans for how to get to hospital when labour occurs. Normal labour is not an emergency and therefore it isn't considered appropriate to call 999 just for transportation to hospital. However, we do know that there may be times when you are advised to call 999 for an ambulance response. Some of these reasons may be sudden onset continuous abdominal pain, heavy and continuous bleeding from the vagina, which is normally more than an egg cup full, any loss of consciousness, your waters may have broken and the baby's cord, which is a bluey white colour, is visible outside the vagina. Your waters have broken and the baby's foot has slipped down, meaning your baby is coming feet first instead of head first. Your labour has progressed so quickly that you believe that you will not make it to hospital and instead you will have your baby at home. And you may need to call for other emergencies such as breathing difficulties, chest pains or any fitting. On occasion, if you have spoken with the midwife, they may also advise you to call 999 for an ambulance response. And if your midwife has advised this, please let the call handler know when they answer the phone. When you call 999, one of our call handlers will speak to you, and the first question that you will be asked is the patient breathing? This is to allow us to triage your call appropriately and is always the way. Please speak to our call handlers nice and calmly. They are here to help you, and the nice, calm response and answering their questions will allow us to issue an ambulance as we need to that is appropriate for your situation. Before the crew arrive, please could you put away any animals? We know that your animal may be nice and friendly and very affectionate towards you, but it can be quite upsetting for them to see someone that they care about in a difficult situation, and also quite scary to see new people in their house in a uniform. It would also be very helpful if you could have your hospital notes ready for the crew on their arrival, including open on your phone if your notes are now electronic. The crew will want certain pieces of information, and things that are very helpful to tell them when they arrive is if you've had any babies in the past and how many babies you've had, including how these babies were born. For example, it's very important to know if you've had a cesarean section before or if you had a hemorrhage in the past. We would also like to know how many weeks pregnant you are and if you suffer from any long-term medical problems or take any regular medication. If you are calling because your baby's being born, please can you close all the windows and doors in the house to stop any drafts coming through, because small babies get very cold very quickly. Although we do ask that you leave the front door unlocked so that the crew can get in without any problems. Could you also please warm some towels, either on the radiators or if you have a tumble dryer, so that we can keep our babies warm when they're born. If when you call 999, they haven't sent you an ambulance straight away, they may put you through to one of our over-the-phone clinicians. This is quite normal, and please be patient with them when they speak to you. It's just making sure that we have all the information that we need and that we issue the appropriate ambulance response. Our frontline ambulance staff are not trained in all elements of maternity like midwives, such as water birth. So if you are planning a water birth, please don't enter the water until your midwife arrives on scene. And if you have entered the water and the crew arrive, please respect and follow their instructions when they ask you to get out of the water. It's just ensuring that our ambulance crews work within their knowledge and scope of practice and that you are as safe as possible. The ambulance staff may also contact the maternity unit on scene for further advice. And this is because, as we mentioned earlier, they are the experts in the field and their advice will be followed. If the crew recommends that you are taken to hospital, please follow that advice so that transfer can occur as safely and quickly as possible. If you haven't spoken to your midwife and something else is happening, for example, your waters have not broken or you are in early labour, you may be advised to make your own way to hospital. If you call 999 and it isn't the emergency, you may be advised to make your own way to hospital. In the event of an emergency, you will always be transferred to the nearest open maternity unit. We recognise that this may not be your hospital of choice, but it is important for the safety of you and your baby. And it may not always be the closest hospital, as if the maternity unit is very busy, they may have deferred elsewhere. If your baby's born at home and you require transport to hospital, it may be necessary that your baby and you are transported in separate ambulances. We know that this is not ideal, but it's important so that we can keep yourself and your baby observed and secure, and that we have a crew to care for each of you. But don't worry, your birth partner can travel in the ambulance with your baby or with you, whichever makes you feel more confident and more comfortable. Please be respectful to all our staff, from call handlers to our contact centre clinicians and our frontline crews. All of our staff come to work to do the best job possible, and if we work together, we can provide you with the most positive experience we can.